President, but before I get into that, let's get an update on KEMSA. The Ministry of Health has been ranked the second most corrupt ministry in Kenya. This comes 2 days after President William Ruto fired Principal Secretary Josephine Mburu, KEMSA CEO, and the board members of the irregularities on a global fund tender on mosquito nets.
Just 2 days after President William Ruto's sweep at the Kenya Medical Supplies Agency, the plot seems to thicken within the Ministry of Health.
If we see corruption as a disease, which indeed it is in our nation, we should work much more on prevention than waiting to fight it after it happens.
According to the Ethics and Anti-Corruption Commission's latest report on corruption and unethical conduct in the Kenyan healthcare sector projects, the Ministry of Health ranks as the second most corrupt ministry in the country. The survey was carried out in 25 counties. The intricacies lie within the procurement process, which has been marred by malpractice, favoritism, bribery, manipulation of cost and embezzlement of funds, approval of substandard work and materials, and political influence among the top interference in the tendering process. This was recently witnessed in the 3.7 billion shillings Global Fund mosquito net scandal involving KEMSA, which saw the Public Health PS Josephine Mburu and the KEMSA board sent packing.
We want to ensure that KEMSA does its job, and just doesn't do it but does it well, that they have to be stocked on the most essential drugs and health commodities needed to serve Kenyans.
Meru, Tharaka Nithi, Embu, Nakuru and Marsabit are the top 5 counties which had healthcare projects that had been completed above the planned budget. In a bid to clean up the rot at Afya House, Nakhumicha says the ministry is changing gear towards local manufacturing of drugs, which will ensure sufficient stock-up at KEMSA while ensuring an open tender process. Helen Aura, NTV.